and the lateral ventricle. Say the lateral ventricle. You can compare it to the normal tissue. Here is the normal structure, but the blue arrow, this area, is necrosis. Yeah. The tissue structure is loose. You can compare the normal. Here is normal, but this area is a loose tissue. It means the necrosis tissue liquefied. So the hypertension or maybe atherosclerotic plaque in small arteries of brain can cause ischemia and necrosis of the brain. Okay, you see the videos here. Yeah, it's just the same, this area. Here is necrosis, but this is normal. It's the lateral ventricle. Okay, it's very simple. Gangrene, the dry gangrene of the hand. Just look at the hand and fingers. The black-red color at the border is also clear. Here is the border. Sure. You know, some disease, just like arteries, these vessels maybe have some inflammation or obstruction in artery and can cause the ischemia of the fingers, palm, or maybe hand, a large area necrosis. Here is also video. Okay, dry gangrene. Black. It's very easy. So when your final exam about the lab exam, if we give you this group specimen, can you write dry gangrene of hand? Yeah, tick. If you write his name, tick. So it's very simple group specimen. Here, cavitation. It means a large cavity. Yeah, you can see the kidney, but this kidney is destroyed. So many cavity. Some may be large and some may be small. Many cavity in the kidney parenchyma. Here is the context and it's red dollar, but you can see many cavities. Why? Tuberculosis. We'll study this disease in the last chapter. Yeah, infectious disease. Infective disease. We'll study the tuberculosis. Now we know it's a bacterial infection. Yeah, the bacterial infection can cause maybe the tubercle or maybe KCH necrosis in the different organs or tissues. Here, the bacteria infected the kidney also can cause necrosis. Sure. The first maybe KCH necrosis. KCH necrosis in the kidney. And then the necrosis tissue liquefied and flow out through the urine duct. Yeah. Can flow out through the urine duct. And here just remain a large cavity. It means cavitation of kidney. It's caused by the tuberculosis. We also have this video. It's also kidney, yeah. Tuberculosis of kidney, more cavity. So maybe KCL necrosis, yeah, it means KCL necrosis and when liquefied, it remains a cavity, like this one. Another consequence about the necrosis tissue is calcification. Calcium deposit in the necrosis area. It's long. Who draw the line? Okay, continue. This is the lungs, cut surface. We noticed here, yeah, a very small pale or white particles in this area. Very small, okay? High power, it's white or pale calcium deposit in this area. Sure, this patient also a tuberculosis in the lungs, a primary tuberculosis, and first maybe exudation and some kidney necrosis or small kidney necrosis in this area, and then the calcium deposit can form the calcification. Why you like to draw lines? Oh, you write JIM? Who write this on my screen? Yeah. Can you erase this line? Okay. Calcification. It may be have a long time or long period after necrosis. So if calcification, the tissue is hard. Yeah, the tissue may be turned hard. Use our naked eye, we just see a pale or white area and hard area. But if we use microscopy, can you guess what color? Yeah. If you use microscopy, what color about the calcification area? Can you guess it? Blue or blue-gray. Yeah, it may be blue or blue-gray deposition particles deposit in our HE staining. Okay. Then we studied some pigment. Yeah, many pigments in our bodies. Here is endogenous pigment, hemosiderin. We know the hemosiderin is come from the blood red cells. Yeah. We just studied the heart failure cells. We know when the pulmonary congestion and the blood red cells entered the alveolar cavity, yeah, macrophage can phagocyze the erythrocyte and formed heart failure cells. So many hemosiderin deposit in the lungs. This is hemosiderosis of the lungs. It means many hemosiderin deposit. Some may be in the cytoplasm of macrophages. It's also endogenous pigment, but we know it's a tumor. Yeah, malignant tumor, melanoma. It's an eye. You can see the whole eye is replaced by a black area. This black area is a tumor. The tumor cells can produce more and more melanin. This is the retinal pigment epithelial cells. The tumor cells is come from the retinal pigment epithelial cell. It's also melanin. Here, melanoma, a black area on the skin surface. It's a cut surface, this area. Here is the epidermis, and the tumor in this area. So when I talk about the melanoma, we maybe know about the nevus. Yeah, in our bodies or on the surface of the skin, we often can see many nevers. Some may be small and some may be large, but it's different from the melanoma. Nevers have a different type, but when the nevers is large or maybe formed an ulcer, or maybe you feel the pain about the nevers, so I suggested you should to see a doctor, because some nevers, some types of the nevers can form melanoma. Yeah, it's a malignant tumor, so we must notice if you have some nevers on your skin surface. You must notice the different types. Some nevers is the cells. These cells have many melanin deposits, but the cells may be in the border of the epidermis and the dermis is the borderline nevers. These types may be malignant to turn into the melanoma, but some may be the whole nevers is in the dermis. It's okay. Yeah. If the whole nevers, the pigment is deposited in the dermis, it may be okay. But if it's in the borderline, the dermis and epidermis, we have the basal membrane and the basal layers of the epidermis have some pigment cells deposited in this area, also can form nervous. Okay, we have the no this radio. Okay, the outer pigment, exogenous pigment, also can deposit in the different organs. It's very easy. Anthracosis. Yeah, this is lung. This is lungs. You can see the black particles. Many black particles deposit in the lungs. It's anthracosis. So, our air pollution. So when a baby born, say the baby's lungs is very clean. No this dust or no this carbon dust in the lungs. But when we grow up, year after year, and when we age, more and more carbon dust deposit in our lungs. Sure, this carbon dust entered our bronchus and alveolar cavities, also can imbibed by the macrophage. Yeah, it also can eat by the macrophage and formed some dust cell. We see the dust cell, it means in macrophage cytoplasm of the macrophage, you can see some black or dirty particles, the dust cells. We have this video. Okay, it's also many black carbon dust deposits in the lungs. Here we can see many black dust anthracosis. And this patient may be a minor, some minor and cold can deposit in the lungs. So we compare these two lungs, the two patients. This lungs clear. Here we can see small particles. Yeah, this small black area may be dust or carbon dust deposit. It may be lived in a very rural setting without the severe air pollution. But this one, co-workers' lungs, black area. Lungs may be many fibers and cirrhosis, and the whole structure is destroyed. So we can think about the clinical syndromes, dyspnea. Yeah, many blank or many dust deposited in these lungs. The patient maybe have dyspnea. It's very easy. A butterfly? Yeah, it's a butterfly. On the skin surface, we can see a butterfly. It's very beautiful. Sure. When you inject some particles, some pigment in the dermis, our macrophage also can eat more and more pigment and combine this beautiful butterfly. It's also the exogenous pigment deposited in the dermis. Okay. This one is also growth specimen about healing by first intention. It's very simple. It's just a cut operation. Healing granulation tissues, very less, and we just see a line cut operation. This is the skin. It's very easy. Okay, next we show some tissue necrosis and the granulation tissues in microscopy. Here is the coagulative necrosis of kidney. We have studied the spleen. Yeah, coagulative necrosis of the spleen, but we know spleen, kidney, and the heart necrosis is coagulative. This area is pale or white area in necrosis tissue. Coagulative necrosis. Microscopically, here, many inflammatory cells around this area. This area is necrosis tissue. We also can see the glomerular. This is glomerular and tubule. Yeah, maybe some proximal or distal tube around the glomerular. But this pink area, no nuclear. No nuclear. Around this area, here is inflammatory cells, many inflammation around this area. High power. We also can see glomerular and tubing around in this area, but also no nuclear. So necrosis tissue. The character of the nuclear disappear. Nuclear disappear. Here, this is the border. Some noise in your microphone. High power. Why? Who is speaking? You can replace me to give a lecture.
No, she's speaking loudly.
Guys, please turn off your mic.
Okay, we continue. It's also necrosis of kidney. Is low power. You can show the borderline. Here, I draw a yellow line. This area, it's a borderline. You can compare. The left part is necrosis tissue, and the right part, this is the normal or maybe inflammatory cells or maybe congestion or hemorrhage in this area. The character, we have said the nuclear is different. The right part, many nuclear, but the left part, no nuclear. We just say the glomerular and many tubes in this necrosis area. This is the border. So coagulative necrosis of the kidney is a character. High power. It's a necrosis area. You have high power, also can no nuclear. It's glomerular tube. Yeah. Proximal. This is the proximal tubule. Okay, next we see the KCS necrosis. But when we see the lymph node, I think I should to review some normal histology about the lymph node. You know, our pathology is difficult, but we need some basic knowledge about the histology. Sure. This is lymph node, mesenteric lymph node, and here is the cut section of large node. It's a large lymph node. We can see the cut section. Some may be white or pale color, and some may be red color. It's a fresh specimen, so we can see very fresh color surface. It's a basic structure of the lymph node, a normal structure. Here, you can see the capsule. When we cut a lymph node, you also can see a capsule around. This is a connective tissue around the lymph node, means capsule. And then this area, cortex. And here, medulla. Yeah, cortex, medulla, capsule. In the cortex, you also can see many lymphoid nodules, and the medulla maybe medulla cord. This is medulla cord, and the sinus. So lymphoid entered from this. Yeah, this is a lymph vessel, afferent lymph vessel, and this is efferent lymph vessel. This is artery, vein. The artery and vein also form the capillary, the blood capillary, and entered the sinus. Yeah, many sinus around the cortex, or maybe in the medulla. Many sinus. So it's a normal structure. Here is the HSCT. Microscopy also can see the lymphoid nodules. This is the cortex. Here is medulla, the medulla cord and medulla sinusoid. This area. The outer is capsule. This is the capsule, connective tissue. Okay. This is the connective tissue covered on surface. And this connective tissue, just like the spleen. I remember we reviewed the normal structure of the spleen last time. Just like the spleen can enter the lymph node from the some tropical. This is the cut section of the tropical. It's also the connective tissue from the capsule can enter the cortex. Okay. Here is cortex. In the lymph node, you can see a chiral cortex. This area. Can you see the different cortex and the chiral cortex? The cortex is mainly lymphoid nodules. It's mainly the B cells. It's mainly combined by the B cells. But the chiral this area is mainly combined by T cells. So different. This area more and more B cells, and this area more T cells. This is medulla. Yeah, medullary sinus and medulla cord. It's called also some lymphoid tissues. Okay, however, also can see the capsule. This connective tissue from the capsule, however, and here is subcapsular sinus. It's empty cavity. It's subcapsular sinus. It's very important. When we first to had some antigen or with some malignant tumors, the tumor cells metastasis through the lymph node. This area can see the malignant tumor cells. In the subcapsular sinus. In this area, first attach the lymphoid fluid. It's very simple. Many cells in this area. Okay. It's a normal structure. Then say the abnormal. Here necrosis. It's a landmass of many lymph nodes by the landmass, but on the surface you can see a pure or white area. This is here's necrosis. Here's it means white or yellow-white section about these tissues, just like casing. Like a surface of cheese. Here's necrosis of lymph node. Sure. It's not one lymph node. It's many lymph nodes and become by a large mass. But you can see it's white of pure area. It's here's necrosis. This area is normal. This area is normal structure. But this area is necrosis tissue. It means the yellow-white necrosis area. Okay. In my microscope, you can see the capsule is area, and here is some remains lymphoid nodules and many lymphocytes in this area. But we must notice this area is different. This nodule is different from the lymphoid nodules. Can you compare this one and this one is different. This is the lymphoid nodules. This one is the tubercle. It's tubercle. It's not lymphoid nodules. It's tubercle. What is tubercle? Sure. Now maybe you cannot understand why tubercle in the lymph node. Sure. This lymph node is infected by the bacteria, tuberculosis. So when bacterial infections and formed a granuloma, we studied the granuloma in the next chapter, inflammation. It's a granuloma formed in the lymph node. The given name is tubercle. It means many macrophage proliferation and some epithelial cells combined nodules, also named granuloma. Here is necrosis. It's pink area. No nuclear. It's also necrosis tissue, so no nuclear. It's just the pink or particle area in the lymph node. Here, lymphoid nodules, but this one is tubercle. It's granuloma. The color is different. You can compare this color and this color. It's more and more lymphocyte, but here is macrophage and epithelial cells. epithelioid cells is also come from the macrophage. You know that when macrophage phagocized, more and more bacteria can change the shape. It's just like epithelium. Yeah, and maybe the shape is like epithelium. You see epithelioid cells combine the granuloma in this area. And here is also KCS necrosis. This area, no nuclear, just the pink particles. Okay, high power, a large area. This is also necrosis, KCS necrosis at high power. And the next, let's say granulation tissue. You know, low power, we can say that combine many capillaries. This is a different section of capillaries. Many blood red cells, lumen. Yeah, as capillaries, and some may be fibroblast, just like this one. Yeah, this is fibroblast, and the inflammatory cells around these capillaries, and combine the granulation tissue. Some may be hemorrhage. See this area, hemorrhage. Okay. Capillary. Yeah, we say the newborn capillary. What is newborn? It means the capillary maybe have a second wall, but some fluid, the blood serum, may be exuded from the uncovered epithelium. So we often can see this empty area have some fluid. Yeah, maybe water or albumin or other proteins can exudate from the newborn capillary. This is this area. It may be empty, but it's not the real empty. It may be edema, or maybe collagen, or glycoproteins, yeah, in this area. Because we know the granulation tissue is a connective tissue, so have an ECM, yeah, extracellular matrix, this area. In this picture, I figure out the neutrophils. This is neutrophils. This one, lymphocyte. And this one, fibroblast. In this picture, we can see many neutrophils. Yeah, here, many neutrophils. So we can think about if a granulation tissue, this granulation tissue have more and more neutrophils, it means infection. Yeah, it means infection. We'll study the inflammation, but we know the neutrophils, especially in acute inflammation, we can see many neutrophils exudate from the capillary or from the blood vessels. So sometimes the granulation tissue may be infected. Sure. After a period of time, we can see the healing of the different ulcers or different necrosis tissues. It's just an example. See the ulcer, yeah, on the skin, you can see ulcer. Low power, can see here is ulcer. It's a normal, yeah, it's a normal. But here, ulcer. The first is granulation tissue. In this area, in the basal, we can see the granulation tissue. It's a newborn capillaries and the fibroblast, and maybe edema in the ECM, extracellular matrix, maybe edema, and some inflammatory cells in this area, in the granulation tissue. And then the tissue can form a scar, more collagen. Yeah, here you can see more collagen and fibers. And this is regeneration. Yeah, our epithelial regeneration and covered on the skin. So it's healing. It's healing ulcers. Okay, we take a break and then see some slides. Okay, 5 minutes break.